going to talk next about endoscopic therapies. And what endoscopic therapies refer to are therapies which are done through the mouth under direct visualization, usually with a camera. This is sometimes referred to as natural orifice surgery since it's done through an orifice in the body and does not involve any cutting of the abdominal wall. There are no incisions in the abdominal wall, and because of this, the pain and recovery is typically faster after endoscopic therapies. Some individuals will be required to stay overnight in the hospital. Some of these are done on an outpatient basis. There are multiple approaches to endoscopic therapy that have been tried over the years. Injection therapy was tried, but the product that was used for injection has been pulled from the market by the FDA, so that therapy is no longer available. There's also something called radiofrequency, which involves applying energy to the lower portion of the esophagus, and it's thought that creating that scarring at the lower esophagus will help prevent reflux. And then more recently, devices have been developed to allow a surgeon to approximate tissue from within the stomach and within the esophagus. One of these newer such devices is something called the Esophax device. And with the Esophax device, we're able to do a procedure referred to as the TIF procedure. The TIF procedure stands for transoral incisionless fundoplication. And what this means is that the valve is recreated from the inside of the stomach. The first step in the TIF procedure is the patient is taken to the operating room and placed under anesthesia. The camera is then placed through the esophagus to inspect the valve. The camera goes through the device, and the device is introduced into the stomach under direct visualization. Once the device is in the stomach, the hiatal hernia can be reduced. This is done by applying suction or pressure on the side of the esophagus, and the esophagus can then be advanced, reducing the hernia. The connection between the esophagus and the stomach is then grasped with a small spiral grasper, and this is pulled down in between a fastener. Fasteners can then be placed around the lower esophagus and upper stomach circumferentially to create a new valve. These fasteners are full thickness fasteners which pass from one side of the stomach and the esophagus to the other, and they are made of a permanent material, which means that they will be there forever unless removed or passed. The valve creates approximately a 300-degree valve, and this type of valve mimics the valve that was there naturally more closely than with the traditional surgical Nissen fundoplication. We're going to take a look now at a before and after of how the esophagus procedure can repair the valve. In the diagram shown here, you can see on the first picture there's a small hiatal hernia which shows the upper stomach herniating into the chest cavity. In the second picture, we see that hernia has been reduced. The esophagus has been brought into the abdominal cavity, and several fasteners have been placed through the esophagus and into the stomach to create that floppy valve. This reduces the hernia and creates a new valve in between the esophagus and stomach, effectively preventing acid reflux. Let's take a look at some actual pictures from a TIF procedure. You can see that the first picture there shows the inside of the stomach. The black line that you see at the upper portion of the picture is the camera or the endoscope in the stomach. It's actually down in the stomach looking back up towards the top, towards the valve. You can see there's a gaping hole around the endoscope. That's where the hiatal hernia is and where the valve is dysfunctional. In the second picture, we see that there is no longer a gaping hole. This is an after picture, after someone has had the esophagus procedure. The hiatal hernia has been reduced. There's nice approximation of the stomach around the endoscope. And as you may imagine, when that endoscope is withdrawn, the stomach or flop valve will flap over and prevent acid contents from refluxing back up into the stomach. The advantages of the TIF procedure are that there are no incisions. There is minimal pain associated with this, although there will be some pain along the throat and the esophagus from the procedure. Studies have shown that 70 to 80% of individuals are able to eliminate heartburn medications and have an improvement in their quality of life. In addition, it can be modified very easily if it needs to be in the future. It doesn't prohibit us from going back in and performing another procedure if it does not work. The disadvantages of the TIF procedure are that there's no long-term data at this point. It is still considered a newer procedure. We've only got about 3 or 4 years worth of data on this procedure. So far it appears to be durable. Not everyone who has reflux is a candidate for this type of procedure. There are also some risk of the procedure, and these include the risk associated with the general anesthesia. There's also a risk of bleeding because we are suturing the stomach, and so a suture may puncture a blood vessel, although this risk is low. And there's also a risk of perforation, which means tearing of the esophagus or stomach. Candidates for the TIF procedure would include individuals with a small hiatal hernia who have evidence of reflux demonstrated either on endoscopy or one of the other tests that we discussed. It may be best for individuals whose symptoms are not completely controlled on their anti-reflux medications, or perhaps they have an interest in stopping their anti-reflux medications because of the potential side effects of those medications. Typically, it's for individuals who have had heartburn problems for greater than 6 months. It's not someone who has been newly diagnosed with heartburn. Individuals who are not a candidate for the esophagus procedure are individuals with a large hiatal hernia, individuals who have Barrett's esophagus if it's already progressed to something called dysplasia, which is a precancerous type of Barrett's, individuals who suffer from severe obesity, and some individuals who have had previous reflux surgery may not be candidates for the esophagus procedure. Thank you very much for your time today. I hope that this has been an informational session for you. Please feel free to find out more information by visiting our website at journeyclinic.com.